We are live, purportedly. Hey guys, it's Zen-Dogg. Dr. Z if you're nasty, Zen-Dogg if you're weird. We're live. It's like 4:45 on April 19th, the year of our Lord 2022, the year the mask mandates on public transportation ended before they probably will start again. Come on down, everyone. Let's do a thing. We're on YouTube. I shared this all over. Michael's here, Andrea, June Black, Crystal, Ella Bridges. I'm going to try to pull up your comments on my phone. I don't know if it works. It may not. It's weird. When I go live on YouTube, it never shows me live on this, only on the computer. So I guess I'll figure it out. Let's see. Pull your comments over here. There you are. All right. So, hey, quick thing. The whole crew's showing up. This mask thing, isn't that interesting? So a federal judge in Florida's like, I don't think so. On transportation like airplanes, buses, trains, those sort of things. So the whole TSA sort of mandate thing kind of obviated with the stroke of a pen. Isn't that interesting? So how you responded to that actually says more about your moral palate, your own moral taste buds, than it does about any science or any other thing, because all this, we're all making this stuff up. Nobody really knows what's going on. So if you were like, what? They're going to let all those filthy COVID people on planes and buses and trains without masks? You probably have the moral palate that has a sort of care versus harm, sanctity versus degradation sort of taste bud that doesn't like gross COVID stuff and is in a particular sort of might be in a particular political orientation towards the more COVIDian side, and the mask is sort of a tribal badge of loyalty to that side, and the idea that you don't want to hurt others, so you wear the mask and so on. Versus if you were like, thank God, I don't like those mask mandates, the cloth diapers on the face didn't do anything anyways, yada, yada, yada. You may have a moral palate that is more liberty versus oppression. It may be more about, the freedom piece. You may also feel like, well, cloth masks aren't doing much for Omicron anyways. They're not mandated in most other parts of America now. So why are we still keeping them on these entities? And so really, your stance on that may be partially tribal, maybe partially political, maybe this moral palate thing, maybe your own feelings on what science does and doesn't show about masks, maybe your own level of fatigue with pandemic, maybe your own oppositional defiant disorder versus lack of that. There's a million reasons, right, why you might parse that decision a certain way. And I think it really does say more about that than it does about anything else. Because honestly, I don't really care. I've been saying that we ought to make these things more individual choice for quite a while, because Omicron kind of obviated the ability to control pandemic. Even a perceived control of the pandemic is just out the door. The most control you have is on an individual basis. You can get vaccinated. You can wear an N95 level mask if you're at high risk. And, there's been Twitter going on all over the place about, Jerome Adams. I just saw one former Surgeon General saying it means that a 4-year-old kid who's going to get cancer therapy is going to have to sit on the bus next to somebody who's coughing with COVID with no mask. And that, led to the usual Twitter thing. And someone told me about this tweet. I don't look at Twitter. We dump videos there, like this live video, and then run away, post and ghost, because that's the safest thing to do on Twitter. But this idea that, okay, well, so here's moral palate in action. Care versus harm, right? Oh, this kid who's vulnerable, maybe too young to get vaccinated, has cancer, so is immunocompromised, is at high risk, is poor or not affluent, and therefore has to ride the bus rather than being, driven back and forth for chemotherapy or visits with the cancer doc. And so there's equity issues, care versus harm. There's fairness versus cheating. Like, why is it that it's unfair to this kid who has to ride the bus, but everybody else doesn't have to wear a mask, and this kid's the one who suffers, and so on. So those are all moral palate things, right? Whereas on the other side, you might say, well, but would you have all of society do this behavior compulsory. So in other words, liberty versus oppression, to protect a kid who maybe we ought to have policies in place that provide transportation for the kid that is private or non-bus transportation if they have cancer to go get chemo. And the child can wear a well-fitted mask as best as we can fit it on a 4-year-old child. And so there's some, at least one-way protection there. So you kind of look at, and again, there's a fairness versus cheating on that. So there's a lot of nuance in how you think about masks, but the way that the media, the way that your friends, the way that social media is going to portray it is, oh crap, the sky is falling. They killed mask mandates on planes, or oh crap, this is great. They're finally getting rid of these fascist mask mandates. And there's no room for discussion or nuance or understanding of each other's, feelings or point of view on this. And the truth is, like, from a true reality standpoint, none of it really matters because no views are true. Midnight Baker, I'm okay with putting it back into our hands. We know idiots exist and will always. Take care of yourself and stay home if sick. Well, again, it becomes that, do I individually kind of take control of this? Or is this a public health thing where the state needs to say, oh, no, because people are idiots, we need to make them do certain things, like say seatbelts. People are idiots. They're not going to wear seatbelts. So it's in their best interest to wear a seatbelt. So we're going to make it the law, or you're going to have to pay a ticket or whatever. It protects children. It protects adults and so on. So that's a kind of legal public health intervention from government. And there's still people who are like, no, I don't know, helmet law is same thing. So there's definitely some nuance here. Now, where do I stand on all this? Honestly, I don't care. I've gotten to the point where I just don't care. I've said what I think over the course of the pandemic, and it's evolved and it's changed and it's shifted with new realities and new situations. Once the vaccines came online, I've been pretty consistent about saying, you know what? You have a way to protect yourself. It's called a vaccine. You don't have to take it. You can make that individual choice. And if you don't, then you accept the risk of whatever. I don't think we need a lot of mandates because people can make their decisions. And yeah, it's not going to be perfect. And yeah, hospitals will get busy because people won't make decisions that are in their best interest for health, but they might make a decision that's in their best interest for other things. There are people actually who have panic attacks when you put a mask on them and they freak out on planes and things like that. I mean, it's not the norm, but there's a range of human beings in the world with a range of different attitudes and aptitudes and morality and so on. And I think it behooves us to understand that all views have some truth and partiality to them, and there's no really one correct answer. Lisa Goodman's talking to Risa. Oki is talking to someone else. Let's see, Jason in Flagstaff. I'd be okay with mask mandates on transportation if they provide a decent quality mask like we do at my clinic. No sense in the crap some folks wear. So this is an important piece. So, and I think this gets to the Jerome Adams Surgeon General tweet, which is, hey, look, if you're going to mandate masks, it ought to make scientific sense. Cloth masks don't make scientific sense. They're really not going to do anything for a highly transmissible strain like the Omicron variants. And so this argument that, well, this four-year-old kid's at risk from people coughing on him in the bus. Well, he's at risk if the guy next to him is wearing a gaiter or a bandana or a cloth mask and isn't wearing an N95. And if the kid's wearing a cloth mask, it's even worse. It's pure hygiene theater at that point, and maybe a small inoculum decrease, and maybe the humidification of the air that you're breathing lowers the transmission risk somewhat. But again, we have to see data for that. And the truth is, oh, look, I found your thing. Let's see. Oh, it's Inception. Now I've got your stuff over here so I can look at them without having to stare at my computer. The truth is, if you're going to make those mandates, then you should provide high quality masks. It's not an unreasonable statement to make. Vespertine says our public transit provides quality masks. Well, that's great. That's wonderful. Then maybe there's a policy thing there, right? You know what I think would be nice would be providing quality health care at a low cost that's available to everyone. And that doesn't necessarily mean single payer, but it means that you transform the healthcare delivery system so that you can provide affordable, preventative, comprehensive, holistic care to people for not a lot of money. And that's called Health 3.0. That's what we talk about. We try to talk about on the show. But if you can do that, then you go a long way to issues of equity and all the other stuff that we've swept under the rug during COVID because we're too busy putting cloth masks on 2-year-olds and calling it safety. I'm editorializing, as you can tell. Bandanas are even worse here in Oklahoma. They wear a lot of bandanas, Robert Young. But I mean, you know, in the end, none of it matters if you're vaccinated and you're not super high risk. It really probably doesn't matter because you're generally protected against severe disease, which again gets me to this question of fourth booster. As Vinay Prasad said on my show recently, how many boosters are necessary? Well, however many you have plus one. Is what Borla from Pfizer would say. Now, Moderna just announced that they have this beta variant vaccine that seems to be more effective against other variants like Omicron in their study. But again, without looking at the primary data, it's the pharma study. You just don't know. Bottom line is, as my friend Paul Offit has said, who's as pro-vax as a human being can be, the 2 doses for most people have great memory B and T cells preventing severe disease. For elderly people, people with immune compromise, 3 doses maybe provides better severe disease. 4 doses? Now we're getting silly. But again, if you want to take 4 doses and you're very high risk or you assess your risk is very high, then hey, more power to you, right? But if you start mandating those things, it gets crazy. Mandating boosters for young people is crazy. And I've said this. I said this on Twitter to the great kerfluffle of the California Academy of Sciences, where I said, I can't believe these guys are requiring boosters for 12-year-olds to come to a science museum. And then they said, no, but you can also test out of it if you're 12 and you're not boosted. But an 11-year-old doesn't have to test out of it. So again, the science is where it's worth having these discussions, right? In a nuanced way. Now, you can't do that on Twitter. I learned that the hard way. I'm back on Twitter, like I said, but only post and ghost. The team just drops it like a deuce, like you're dropping the kids off at the pool, just a steaming log and then run. Joanne Costanzo loves the VPZD show. I love the VPZD show too. That's my show with Vinay Prasad. We just have fun. And the truth is, look, you don't have to agree with everything we say, but you'll at least agree we're doing it in good faith. We're not, trying to hurt anyone. We're not evil. We're trying to find truth. Vinay is very passionate about epidemiology and evidence-based medicine. That's his career path. He's written books on it. People are like, he needs to stay in his lane. It's like, this is his lane, guys. Maybe you're not in your lane. Like, even if you're like a rando doc somewhere saying, X, Y, and Z, if you don't study evidence for a living, then it's kind of tough to drill into some of this stuff because there's bags and bags and bags of data, and most of it's garbage. And that goes for a lot of pharma-funded studies on the common drugs we use, which is what Vinay writes about a lot, that a lot of the chemotherapy drugs, et cetera, they really have marginal utility. They cause harm. They cost tons of money, and they don't save lives or prolong lives in very meaningful ways. And he wrote a book on this called Malignant. So I think it's very much his lane to talk about it. Now, I'm just a freaking clown, but also UCSF Stanford trained doc who worked in hospital medicine for quite a long time and took care of tons of patients and has some experience in that. But again, I'm not perfect and I don't have any moral authority beyond I care about this stuff. So let's see, where are we at here? Glenn, hey Zen-Dogg, just got done doing a 15-minute ruck, getting ready for summer construction. Going to be a rough few weeks, waking up early again, yet getting back to work. And people are going back to the office, and some people are freaking out because, of course, there's inflation and gas prices are high. And now they want you to come back just when it's like the most expensive to come back. So, but it is what it is. We got to get back to some semblance of a society that's cohesive, that's connected, where we actually see people in person. Today I had coffee with a colleague from way back in my Stanford days. And we were talking about like what it's like now doing clinical medicine and how difficult it's gotten and how, they were saying, I don't want to out who they are. They were saying that So I'm going to keep it gender fluid. I'm not even going to say it was saying that it's gotten such that, during pandemic, like patients and families have gotten tense and mean and angry and belligerent when you're the only person there who's really trying hard to help them, and they're lashing out. You want to help people, but you're just getting crapped on all the time. And, nurses here at Stanford and et cetera are going on strike. That's going to be a total shit show, you guys. Like the last time this happened, I think it was a disaster. I mean, everybody's hurting. Like everybody's hurting. So in healthcare. And that's what I got out of this meeting. And part of it is because we really are unable to connect with each other. We're in electronic silos due to the electronic health record. We send each other these little stupid messages. This person was telling me about how they communicate now. They have this new Volt system at Stanford for paging. And it's basically glorified text messaging with emojis and everything. And so this person was saying, like, people will text you like, hey, this patient and blah, 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 and then throw in a couple of weird emojis. And then you'll say, okay, do this. And then there'll be 3 more texts back and forth. And every time there's a text, it like blows up your phone. And then you have to go through this process to look at it and so on and so forth. And so it's just become a complete cluster F, right? And this is how we communicate in healthcare, which has always had not the best communication. But remember the days when you had a staff lounge or a physician lounge and people felt connected. They could talk to their colleagues in person. The paper charts, say what you will about the handwriting and all that. It had a tactile kind of sense about it. You could bring it in the patient's room. You could do your note right there. You could quickly flip to what you want. It's kind of organized in the way humans think, unlike the way computers think. It wasn't all about boilerplate and billing. It was all about just quickly communicating and then documenting for legal purposes. So there's something there, right, in the communication piece. And yeah, it was hierarchical and it's a dominator hierarchy with doctors at the top and so on in the old days. But there was a sense of general cohesion. Now it's disjointed, it's siloed, it's chaotic. The hierarchies have been flattened, but not in a way that encourages growth. And, there's lots of work we have to do. Starting to see a big increase in stat add-on venous Dopplers for rule out DVT, clinical indicator, COVID vaccine, R-rated review mom. That's the clinical indicator. Do these people know that the vaccines don't cause blood clots? Except for the J&J, and those are rare blood clots that are not in the typical locations, and nobody uses J&J anymore anyways. So yeah, I don't know what's going on. It depends on where you are. If you're in the political sort of part of the world where you just don't think, so Republicans overestimate, conservatives overestimate the dangers of vaccines, Democrats and liberals overestimate the dangers of COVID. So because it's been stratified that way by tribe and by moral palate and by who you tie to, Trump or Biden or whoever, that's how people, when you poll them, that's how they behave. And of course, they did a poll. Liberals are not so happy that mask mandates are going away. Republicans are very happy that they're going away. So again, it stratifies on moral palate and tribe. Where's the role of science in this? I'm not sure. Because we never did the good cluster randomized control trials. There's the Bangladeshi study that pretty much said cloth masks don't work. You have to wear at least surgical. And even then. So I don't know, guys. I don't know. Lots of work to do. Lots to learn. Janelle Miller says, I loved paper records. You can't hack paper. Paper records don't crash. This hacking business. So I just was watching a piece with a security expert who was talking about Russia and how if there's a hot cyber war and the Russians decide, what, we're going to, time to destroy America. I don't know what kind of accent that was. All I remember is Nikolai Volkov. Remember that from WWF back in the day, World Wrestling Federation? It was Nikolai Volkov and the Iron Sheik. They were the two bad guys because they were the axis of evil back in the 80s when I was watching wrestling. And Volkov would be, would be like, we will destroy you. And he was buddied up with the Iron Sheik. And the Iron Sheik was all like, America, Iran #1. It was awesome. what was my point? Oh yeah. So if the Russians decide they're going to cyber attack us, the easiest targets are hospitals. Ransomware, you basically grab all healthcare data, put everyone back on paper in emergency procedures, and cause havoc and probably kill people. And all it takes is some idiot employee like me to open an email, click open the phishing link, and the next thing you know, the entire EHR is like hijacked. And it's ransomware without the ransom if it's a war, right? And guess what? By the way, a lot of insurance policies don't cover acts of war. So there's that. So yeah, there's something. You guys remember the reboot Battlestar Galactica? It was such a great series, right? Until the end, you're just like, wait, what? But it was a great series. And part of the premise was the Cylons, who looked like humans, could basically take out all of humanity by controlling their electronics. And so in this surprise Pearl Harbor attack, they basically nuke all the planets and control all their battle stars and their spaceships because they're all computerized, and they throw a virus in there and basically blow them all up, except for one. That was the old school Commander Adama. You know, they pick up corded phones to communicate with each other, and there's no computer running the thing, and that Battlestar survives. I start to wonder about healthcare. Like those few that are still on paper, they're going to be the safe ones. Z-Dogg, where do you get your dress shirts from? The shiny ones. Sivo 18. I usually go to Nordstrom for shirts. And I get help from people because I don't know what I'm doing. So I don't know. Anything you've seen is probably from Nordstrom. Or Nordstrom Rack, where you can save a butt ton of money. Love me the Nordstrom Rack, especially for workout clothes. James Kerr, what's the deal with Dr. Gert Vandenbusche? Can you please give us your thoughts? Not sure what to believe. I did a video on him a year or two ago, and I stand by every word of it. I was right, and he was not. June Black, it's scary what a cyber war could do. Would you be paid? How do you buy anything, store inventory, on and on and on and on and on? Yeah, exactly. I mean, we're so dependent on this stuff. Now, what I did see that was interesting is the cyber security expert, for whatever that's worth. It was on one of the CNBC or something. I saw it as a news article on my feed. He was saying, yeah, the Russians are good at cyber warfare, but the Americans are better. And you haven't even seen what we can do because they don't want to reveal operational secrets by doing things. But basically, he was saying that we would basically send Russia back to like the 19th century if it came to a hot cyber war, which I thought was interesting. I don't know if it's true. But, you know, you can probably only do some of those things once because NSA has these technologies that we don't even know about that would be really devastating. It's a little scary. The whole thing's a little scary because NSA having anything makes me nervous. Of course, they're listening to me via Siri right now. So I'm already on however many lists of untouchables. What's going to happen with the new way of charting charges, billing by time, Laura? I've been billing by time for a long time. You have to document, you know, 30 minutes spent, 50% in coordinating counseling. So I don't know if are they changing that elsewhere where now people are billing by time? The whole thing, the whole medical billing quagmire is a disaster. Like the fact that we even do billing the way we do just encourages us to do things to people instead of for people. The way that we bill currently, it's all these widgets, right? We ought to it ought to really, I mean, there ought to be bundled payments and those kind of things, but you have to compensate for when there's complexity. It becomes tough. How do you get paid? You know, I've always said you should do well financially if you do the right thing for patients and for the team that's taking care of patients. So a healthy team with low turnover feels they have the tools, resources, and autonomy to take care of patients and each other will do better. They'll have better outcomes. So you fund that, you give them those tools, resources, and autonomy as a leader, as a administrator, and then you let them do their thing. Autonomy means trust. It means you've given them tools and resources. You trust them to do the right thing. And if they don't, it's going to show up in the bottom line somehow. So how will that be? Well, if patients are sick and you're penalized for that, they get worse or they don't have access or whatever it is. Now, it's tricky because a lot of this is patient behavior and patient expectations and patient education, which cannot fall all on the healthcare system. And yet it often does, because society drops the ball. We don't have the kind of societal safety nets or infrastructure that they have, say, in Europe. And so we spend more on healthcare because we're doing those social things in the healthcare space. Yeah, it gets interesting. Let's see. I love Nikolai Volkov and the Iron Sheik, says Rob Seaver. But when Sergeant Slaughter briefly defected to the axis of evil, it nearly broke me. I remember that. Sergeant Slaughter committed treason and defected, and he was with Nikolai Volkov and the Iron Sheik, and everyone was like, what? Mean Gene Okerlund was like, this is an amazing development. Sergeant Slaughter, you know, I don't know. In my country, we call that treason. Of course, it was all acting, or was it? I don't know. You go off the top rope with the people's elbow. You tell me how you can fake that. Patient behavior should be billed to the patient. Hitting them in the wallet may motivate change. Road Pizza. Okay, this is interesting. Let's talk about this for a second. So, I think having skin in the game for patients is important, but here's where it becomes very tricky. A lot of times patients have no ability to control their skin in the game. For example, you're uninsured. Something happens. You don't have access to education or tools to be able to self-diagnose. You don't have a primary care physician because you can't afford it. So you go to the nearest ER where you're seen. They do a bunch of expensive garbage to you that you don't need, that if you'd had a PCP, they would have been able to call or connect and say, no, we know this patient. Here's the story with this patient. You just need to evaluate this, or just send them home, send them to me. I can see them in the morning, have good follow-up. We'll call them. We'll have them talk to our health coach, whatever it is. Instead, they get a bill for $2,000 for unnecessary care that was never disclosed, never transparent in terms of the price. And it's completely marked up to the charge master rate, which is much higher than what insurance negotiates for discounts. And they're stuck with that bill that then causes them to go either medically bankrupt or destroys their credit rating, or they just don't pay it. So that's one extreme of, like, they have no control over that. They don't have control that they developed a cancer that was not, you know, lifestyle related, all these other things. Even the lifestyle stuff, to some degree, they don't control that they grew up in a food desert where they can't exercise because they're going to get shot. Or their genetics, you know, whatever it is that led to worsened risk factors, obesity. They didn't ask to be born, whatever race it is, that by definition, just being born that race, you're more likely to have high blood pressure, whether it's due to constantly being afraid the police are going to stop you, or whether it's some genetic thing, it doesn't matter. So those elements you have to tease out from the element of, like, man, I'm just going to smoke and drink and carry on. I don't know what that was I just did, but it represents patient choice to do things that are dumb and they know it. Well, in that case, then maybe the wallet hit is a good thing. I think having some financial skin in the game, if you can afford it, is always a good idea, because it also prevents, like, I was going to say it prevents overutilization. There is a component of that, but it can also prevent preventative care. Like, for example, having high deductible plans, it often can prevent people from going in when they need to if the deductible is high. I have a like $6,000 deductible, something ridiculous. You're damn right I avoid the doctor. I avoid the doctors because doctors suck. A. B, I know they're mostly going to do a bunch of bullshit that I just figure out myself. But it often means that my kids, like, suffer in silence until something finally snaps and we take them to see the pediatrician. And then we get a $500 bill every time, every fucking time. Sorry. I get upset. We're patients at Sutter Health. They are price gouging assholes, the leaders there. Like, they've been sued for this. Like, it's like, come on, guys. Tell us what it's going to cost before you see us, before we see you. Can we do that? If it's non-emergent, even if it's emergent, tell us what it's going to cost. I don't want to get 3 bills, one for the doctors, one for the facility, one for this, with no itemized thing. Then we have to ask for the itemized thing. Then you could realize, wow, $34 for a thing of bacitracin. Okay. And then you go through and then you get another bill. And then it turns out, oh, well, it's high deductible plans. So you're paying all of it anyways. And, oh, first world problems because you got money. But hey, what if you don't? Right? It's disgusting. Let's be honest. It's a moral fucking outrage that these huge health systems do this. Now, the frontline doctors and nurses and PTs and dietitians and all of them, it's not their fault, but they're caught in it, right? They're caught in this. You know, Marty McCary and I have talked about this. We've done shows on this. He wrote a book called The Price We Pay about this. It's not hard to solve this problem, but it takes the legacy players, insurance companies, pharmaceutical companies, big health systems, group purchasing organizations, PBMs, all of these people to, first of all, half of them need to disappear, but then the rest of them need to agree and say, we need price transparency and true competition, true openness. And guess what? It turns out often the least expensive people are the ones that do the highest volume and are the best at it. So in medicine, cost doesn't even correlate to quality most of the time. Really, it's morally outrageous. It's like a deep psychic wound on many healthcare practitioners when they really feel into what we're complicit in. But again, we're not running the business, most of us, and it's outrageous that, like, I forget what the statistic is, but the majority of bankruptcies in the U.S. are medically related bills and things like that. It's crazy. And, you know, Morgan Underhill says, being a diabetic, I'm so grateful I have insurance. Yeah, right. But where are those healthcare costs coming from? Where's that insurance money paying out from? Your wages or the wages of others. It's suppressing wages in the country when it's a third of it's more than, it's like half of GDP when you count Social Security payments, Veterans Affairs, TRICARE, all the government spending on healthcare, because most people will often use their Social Security payment to pay medical copays or medical bills that fall through the cracks of Medicare. And so where is all this money coming from? Us, our wages that stagnate, economic growth. It's an albatross around the neck of the United States. And listen, I'm warning you guys in healthcare, they will single payer this thing and fix it, which will break it for you a lot of the time. Now, some things will be a lot easier billing one insurance payer. My feeling is we better fix it so it's affordable. Then I don't care who pays for it. Employers currently foot 50% of the bill. You know, 50% of Americans are funded through insured through their employer. And a lot of those are self-insured, meaning they are the insurance company. They are the ones paying the bills directly. So it's in their best interest to have employees that are healthy and happy and mentally healthy and so on. And so they have all this leverage, but they refuse. They're terrified to use it. They're terrified to use it to improve the healthcare system because they're worried about next quarter or will their employees revolt if they're limited to where they can go to good providers and so on. And so these are the conversations we need to have. I've been having them for the last, I don't know how many years, going around the country talking about this stuff. And I've talked to these big employer groups and things like that. And you can tell they want change, but they're very scared. But they have all the power. So they should do it. Green Smoothie Party says, typical TV ad. You are clogging up nicely, but don't worry. Big Pharma is waiting in the wings to take away your pain, your money, your life. Ask your doctor if ignoring the root cause is right for you. That's pretty funny, and it's disturbingly accurate. Now, pharma does wonderful things. The vaccine thing is actually a big deal, you guys. Like, it's a huge accomplishment. But now they're dragging it through the reputational mud by saying, well, the third booster, well, how about a fourth booster, and how about we mandate all this? It's like, dude, you did a great thing. Shut the hell up. You made a ton of money. Shut up. Stop. Pump the brakes. You did good, Ace. With government money, with our money, you did great. Now shut the fuck up. But yeah, we don't look at root cause. We don't look at the biopsychosocial aspects, as my friend Dr. Rachel Zoffness says, that everything is biological, it's psychological, and it's social and environmental, and so all those things interact. But pharma would have you believe it's all a receptor, it's all a pill. And then patients and people, normal people like us, will expect miraculous things. And when we realize there are no miraculous things, this is one of my problems with the whole early treatment crowd, right? They're all like, well, you have to forget the vaccines. What about early treatment? Yeah, early treatment's cool, but there's no magic pill for this virus, right? Even Paxlovid's pretty effective. It's not a magic pill. And how do you give it? Do you give it for everyone who tests positive? Well, most of them are going to get better by themselves. Now you've given them something with potential toxicity that costs a ton of money. So how do? You have to risk stratify. You have to make these Bayesian decisions that are not that simple. Computer might have trouble doing these decisions, right? Requires some degree of intuition plus mechanical intelligence that a computer can do. It's not easy. So this idea that, well, we can just cure this with ivermectin, which by the way is horseshit. That's another thing I'm quite proud of, is being early on the ivermectin bandwagon of, hey guys, I'd like to actually see good evidence that this works. Oh, my wife is texting me, what's your status? Doing a live show. When to come home? Question mark. I'm sure Vanderbilt won't have nurses soon, says Beth Marie 44. Right. So then what we do is we throw our frontline healthcare staff that have been through the ringer under the bus. We criminally charge them. Now, that whole case, let's be honest, that was pretty negligent. Like, I am sympathetic to people who are like, yeah, that's criminal negligence in terms of how bad the negligence was. Okay, that's fine. But we don't typically charge. That's not typically how we do quality improvement and safety in medicine, because if you start criminally charging people for screwing up and being lax and overriding and, you know, blowing through warnings, by the way, we've all done that, you're not going to have anybody. And you're certainly not working in medicine, and you're certainly not going to have anybody reporting errors to improve the system, because that Vanderbilt error was partially systemic. Big time, right? The hell is Vecuronium doing in that cart? Why can you do those? Why wasn't it talking to Epic? Why did she have to override in the first place? All the other shit. But that's one thing. And then you can actually take an analogy. A lot of law enforcement people have sent me messages after I did a video on that, on Redonda Vought. And by the way, I hope her sentencing is lenient. That's coming up at some point. A lot of law enforcement people said, listen, guys, like, this has been our story forever. We make a mistake, we pull out the taser or the gun instead of the taser, as happened to a female officer. You get arrested, your life is ruined. You go to jail with the people you were arresting previously. Like, you make a mistake and that's it. There's no, and again, people will argue and say, no, there's a code of silence and all that. But why would that, partially, why would that be? Do you want that to happen in medicine? That there's a code of silence. It's already happens. Like, a lot of doctors cover for each other. Oh, we all know that guy's like, what is it, Hodad in Marty's book Unaccountable, that was based, the Fox series The Resident was based on. Hodad, Hands of Death and Destruction. Everybody knows that surgeon in their program that they wouldn't let operate on their dog, yet the guy still operates. Like, let that sink in. There's the code of silence in medicine too, because everybody's afraid. Everybody's afraid that the eye of Sauron's going to turn to them, because we all make mistakes. So, sorry, texting the wife. Dude, never keep your wife in the dark about when you're going to come home, especially, when it's coming up on dinner time, because otherwise you're going to come home to a punch in the face. I'm abused physically by my wife. I'm just kidding. I'd be into it. Rebecca Shaw, what are your thoughts on getting shingles vaccine for women over 50? Get it, Rebecca. So I'm turning 49 soon, my last birthday of my 40s. And when I go 50, I'm gonna get that Shingrix, because it's very effective. And I had chickenpox as a kid, which means, as you age, your immune system gets weak, or you get stressed or whatever, immunocompromised, you can get shingles, and shingles can be very painful, and it can actually have long-term chronic pain stuff in some people. So, and if you're very immunocompromised, it can disseminated zoster, and that can be life-threatening. So Shingrix is highly effective, more effective than the previous vaccine, but it does cause these kind of immune symptoms like the mRNA vaccines. Like, people say it'll knock them out for a day or two with fevers and that kind of thing. So there's that. But yeah, see, Julia Smith says Shingrix was brutal. The brutal vaccines that cause those symptoms are the ones that seem to be the most effective. They really are, because you're getting that immune system response pretty clearly. Anthony says, Z-Dogg, should I get my booster dose? I'm 25. Well, Anthony, do you have any comorbidities like obesity, hypertension, diabetes, asthma, lung disease, those kind of things? Are you on immunosuppressing drugs? If the answer is yes to that, then probably. If you would like not to have the aggravation of, if you want to lower your risk in the short term of getting infected at all, you can get a booster. It might lower your risk a little bit because your neutralizing antibodies go up. Not so good against Omicron, but better than nothing. But if you're just worried about dying and you've gotten the other 2 doses, Paul Offit would say you're good, right? And I trust Paul. Like, he's the guy I'd listen to. Brandon Hoke says, been a part of one malpractice suit just because I was covering on a weekend and all docs involved in the case were named. Turned out okay for me, but yes, but by the grace of God go I. Oh my God. In malpractice, I've not been named in cases, but by the grace of God go I. Like, it's just a matter of time. People make mistakes. Now, the data seems to show that when you're open, you have good relationships with your patients, when you actually apologize and are transparent when a mistake was made, you're less likely to be sued. And that just makes sense because that's just called being a good human being, unless, the patient is a malicious actor, which occasionally does happen. But yeah, and we practice in a way that's so defensive that doesn't do the patient any good. Let's see. Road Pizza says, not getting Shingrix. I know what shingles look like. I'll take my chances. Too many ED visits for miserable side effects of the vaccine. Well, look, man, it's your choice. Like, you getting shingles is not going to affect really anyone else for the most part. So that's a personal choice. You can decide, do I want these like short-term transient side effects, or will I roll the dice with shingles? For me, I've seen enough shingles that I'm like, hell no, I don't want that. And I know what vaccine side effects are like because I felt them with the COVID vaccines, and I'm like, I can man up and get man flu for a day or 2. It's cool, but that's my decision, right? And you make yours, and you should have every right to make that decision. It's not an uneducated decision. Janelle Miller, I had a very severe case of chickenpox where I stopped breathing. Should I get the shot earlier? I'm 49. Talk to your doctor. I can't give individual medical advice. Speaking of malpractice, and nothing I say here is individual medical advice, as you guys know, as it says all over the disclaimers, because people are crazy. They think I'm giving them individual medical advice. They'll email me asking all these questions. I'm like, dude, are you high? First of all, I charge you so much money for individual. I'm kidding. Ball boys, I think comparing medical errors with police shootings is incomplete. The barrier to entry for police having a bachelor's degree and an intact brainstem. Oh, so you're pointing out something important, which is the degree of training for police officers may be woefully inadequate relative to, say, in healthcare, where training is also variable. Believe me, there are certain checks and balances, but minimal in healthcare. Like I said, HODAD. Hands of Death and Destruction. You can have a surgeon, and there was that whole thing, Dr. Death, right? That whole Wondery podcast, where the guy was clearly insane, and yet people cover, and lives were lost and mangled and destroyed. And so, yes, but also well-trained police officers can make a mistake, but also there are malicious things that happen, and also there's prejudice, and also there is racial profiling, and also so all that is true. But what's the answer? It's never going to be very simple. But I think your point is well taken. Let's see. Joe Swaim, why are the Chinese locking down? Do they know something about COVID that we don't? Yeah, they do. They know that for them, COVID is a political act, that the autocracy has decided we're going to take a zero COVID approach, which means you cannot have cases without doing something drastic, because it worked for them in 2020. It probably saved their ass in 2020 because they could do it, unlike America, which could never pull something like that off because we're actually a free country. The Chinese could pull it off, and they did, and they were able to avert what might have been a catastrophe back then. Of course, we don't know what really happened because data is not free-flowing there. But if you believe the official narrative, which you shouldn't, but if you do, then it worked. And so there's a lot of political capital that the premier has invested in zero COVID. Now comes along Omicron, which violates the zero COVID ethos because it's going to beat through your population unless you kill everyone. And now they have to do this thing. They have to stay with this thing. And they're doing it. Now, what's interesting is they're reporting like no deaths, even though they have a bunch of cases. Now, I don't think that's accurate, but I do think what's accurate, they have 88% vaccine penetrance in China. Now, a lot of that I suspect is Sinovac, right? Which is not the most effective vaccine against this particular strain, but it may protect against severe disease. Again, I haven't seen the latest data on this. I know it wasn't doing so well in South America against Delta. But I'm not up to date on Sinovac because I don't need to be, because I don't plan to get it or recommend it to anyone. But they have high vaccine penetrance. So they're not seeing a whole bunch of deaths if we believe those numbers. So why do a draconian lockdown that's going to cause more economic, social, and health harm because people aren't getting medicines, they're hungry in their houses, they're taking kids away from their parents and putting them in quarantine. But it's an economic engine to some degree because they're hiring all these workers, these migrant workers from around the provinces to do the PCR testing and all that. So this is autocracy at its finest. You can't really explain it beyond looking from the lens of the autocracy itself. Like, what's their survival? What does it mean to them, to the Communist Party there, Chinese Communist Party? That's my take on it. Rose says, are you an ER doctor? I'm a hospital medicine physician. So I spend a lot of time in the ER, but I'm not an emergency physician. I take patients from the ER and admit them to the hospital. I'm an internist by training. Lisa Marie, who's been a member of our Super PAC supporter tribe for 11 months. I haven't had chickenpox. Should I get Shingrix? You haven't had chickenpox, but did you ever have the varicella vaccine then? The chickenpox vaccine? And I'm assuming you're female. Adult chickenpox is very, very dangerous. So can be very dangerous. So you may want to consider varicella vaccine. But talk to your doctor. Talk to your doctor. I'm not your doctor. I can't give you individual medical advice. Thanks for your support, by the way. Rebecca, thank you for the super chat, $20. I really appreciate it. Rebecca Hudson. Alan Taz Blur, one of my favorite supporters, always has good comments. I'm getting the Syrinx vaccine available over at the Temple. Oh, man, Alan, this is why you're my favorite. Nice 2112 Rush reference. This is a good way to wrap this thing up. We are the priests of the temples of Syrinx. All the gifts of life are held within our walls. Yeah, you're welcome. That was awful, and you're welcome. A little Rush rounding us out. I got to go. My wife wants to start the dinner thing. I want to end as I always do. This thing was supposed to be Zen-Dogg because the reason I even went live, guys, is like today. So I had that meeting, did some work, but then I've been meditating quite a bit. So today I just come off like the 4th hour of meditation throughout the day, scattered, right? Whenever I get a chance, I'll sit for an hour, which that's a first world problem. That's privilege to be able to do that. But I get up very early and I'm gotten quite efficient at what I do with work-related stuff. So I'm able to do that. And by hour 4, you know, and you do this a few days in a row, or maybe 157 days in a row. I don't always meditate that much, but things start to really become much more present and much more, hey, Marty McCary's texting me, much more oceanic in terms of you can just drop everything and realize that the only thing that actually is happening is always happening right here and right now to nobody. Just this open, awake presence that all experience is just a modulation of. And that becomes experientially clear. It sounds kind of weird and not right and what? And then you just drop into presence. You just drop into the now and it all becomes clear. And all the stories and the beliefs and I like masks, I don't like masks. The COVID started, the COVID's over. China's good, China's bad. Ukraine. All that is seen for what it is, which is thought and story and belief and ideas and modulations of consciousness. And you're the actual oceanic infinite awareness that all this stuff happens in. And you can be that. You can't think about it. You can't imagine it because that's a thought. You can't even talk about it like I'm trying to do because that's just dumb. but you can be it. And sometimes it's as simple, you don't got to meditate 4 hours a day. I do because I'm an idiot and because my thoughts are just so loud that if I don't calm my mind by purposefully cutting time out to be present and to focus on this, and it may not be breath, it may not be anything nerdy, it's just, oh, what's happening right now? Surrender to this moment. If you dropped all labels and all ideas of who you are, where you are, when you are, what you are, and you just surrender to what's happening right now in front of your face, in your body, in thoughts floating by, what's that? Just look there. That's all you have to do. That's the practice. That's the Zen-Dogg live practice for this episode, April 19th, the year of our Lord, 2022. I hope you guys take care of each other. I was going to say take care of yourself, but sometimes by doing these kind of practices, like just being present, yourself becomes infinite and you can't help but take care of everybody else because they're you.